Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Thank you for joining us for this episode of Being Well. I'm your host, Keanne Armstrong, and today we're going to be talking about laser treatment and injury prevention. And joining me today is Danielle Colvin, and she is a doctor of physical therapy as well as a board-certified orthopedic clinical specialist with Paris Community Hospital. Thank you for coming today and joining us.
You're welcome. Thanks for having us.
Yeah, so this is an interesting topic. I think something new in the area and something that I'm interested in learning about. So we're talking about laser treatment and something called MLS laser. So can you describe what that is?
So the MLS laser is a multi-wave locked system, which just means it uses two different wavelengths to provide the treatment and the proper healing method for a particular area. A lot of research has been done on the feet and for wound care and stuff. So our podiatrist at the hospital had looked into it, brought it to our attention. We researched it and thought it was a good fit. And so ultimately it came to the hospital, which was great. So.
Okay, and so this is the only one in this area, right?
It is, yeah. The closest one beyond Paris is Mahomet. I think that would be the closest one, and then I think there might be one over in Springfield or somewhere. But Paris is definitely the only laser in this immediate area.
All right. Well, if anybody is looking for any type of information on this, then it's good to know that this is around our area now. You mentioned that there are two wavelengths used. Why are there two?
Well, it's great because traditional laser therapy, and a lot of clinics will say that they have laser therapy, and it has been effective in the past, but they just use a continuous wavelength, which is effective for inflammation. So it just kind of promotes the circulation of the lymphatic system, tries to push fluid out of an area, and in doing so, of course, the side effect of that is to reduce pain. But this MLS laser actually has a pain wavelength, so it affects in an analgesic manner directly to the area in which we're treating. So a lot of people walk out the door after the first treatment even feeling some pain relief in that area, and a lot of times these are chronic pain patients, and so it's a really cool selling point for this particular laser. Not only are we affecting the inflammatory problem in the area, but also the pain.
Yeah, because you can walk right out of there feeling better.
Feeling better. A lot of people feel it after the first treatment. Now this isn't, it's a case-by-case situation. Not everybody is going to feel it after that, but a lot of times it takes a few more sessions. But
okay. Well, you mentioned the feet. What other body parts can this be used on, and do you see a difference among the improvements in different body parts?
Yeah, overwhelmingly we've seen a lot of success with the lower extremities. So a lot of our foot ankle injuries or just overuse problems like Achilles tendonitis or plantar fasciitis. We've also seen it be successful in neuromuscular situations like peripheral neuropathy. So it has helped with those chronic problems with people. A lot of times have peripheral neuropathy that have type 2 diabetes, and so there's been some success with decreasing some of the pain in their limbs. Again, mostly lower extremity, but we've had cases with good success of arthritic joints in the shoulder and the back. So, I mean, there's been kind of an array of ailments that have been treated by the laser and been successful.
Okay, all right. And how often would a patient need to get treatment?
Well, what they recommend is 2 to 3 times a week for acute injury. So if you sprained your ankle and you come in and you have a lot of inflammation or things going on of that nature, 6 to 8 treatments, you're going to pretty much feel the max benefit of it. But if it's a chronic problem like arthritis, usually 10 to 12 visits is going to be kind of our limit, and you're going to get the max benefit at that point. So 2 to 3 times a week.
Okay, well that's not so bad. When people think of laser, you think of something that might hurt or might burn. Is there pain associated when getting it?
No, it's actually completely painless. Some people have even been known to fall asleep during their laser treatment. Because sometimes some of the treatments, the protocols are a little lengthy and you just stay in one position, and it's usually, we always try to put the patient in a position of comfort. So then you've got the buzzing of the machine going on, and so, some patients have fallen asleep. But nope, no burning at all. It just uses a different wavelength than some of the other medical intervention lasers out there. So.
Okay, so it's not something that you would see on a movie where you see a light beam or something like that?
No lasers, no, not that type of laser.
All right, so is there anything that would prevent me from having a laser treatment done?
Well, if you're pregnant, we're going to stay away from the abdominal area naturally. Of course, research hasn't ruled out that being a risk factor, and no pregnant woman is usually going to sign up to be part of a research group of that nature. So they just haven't, so they just say, stay away from the low back. But they do know that it is not effective. Like, we've had pregnant women use the laser for patients, and it's not harmful at all for them. It's just directly over that area. Or for those in which have had a injection 2 weeks before or 2 weeks after. So if you've had an injection, then we don't want to increase the circulation in that area, because we actually want that medicine to stay where it's supposed to stay and do the work in that area. So we're not going to do the laser 2 weeks before or 2 weeks after, just to make sure that injection is totally effective in that area.
Okay, so there is some timing involved.
There is a little bit, but really, compared to other modalities out there, very little restrictions. I mean, most people, you can do it over pacemakers, you can do it over knee replacements, over hip replacements, so over metal. In a lot of modalities out there, you can't do that. Or it'll affect the rhythm of a pacemaker. This doesn't.
Yeah, so. That's interesting to me, because I would think that it might upset a pacemaker, so it doesn't.
It doesn't, nope. And they've done thorough research on that, so they found that it is not, and we've done it on patients.
Okay.
No problems.
Good, that's good to know. So you said this technology came available to Paris, and it's the only one in this immediate area. So talk to me again, how did it come here? What was the undertaking, I guess? Well,
really it was our podiatrist and wound specialist that kind of got the ball rolling on it. And then he came, the laser specialist, I guess, came in and did kind of a mock of some of the different protocols on the therapy team, and we liked what we saw with it. And then the hospital foundation actually has a fundraiser every year, and this year all those funds raised went towards this laser, so that was amazing for the foundation to support this modality and this tool that our therapy team has now been able to use and service the community with. So.
Yeah, absolutely. People coming together to help one another.
Yeah, they've been really great in supporting it. So.
Okay, so if a patient is watching this program right now and they're thinking that might be something that I could benefit from, how would they go about accessing this type of treatment? Do they need to go to their physician? Do they need a referral?
They do. Because it is a modality, we use it in adjunct to our skilled therapy knowledge, so we still want them to come in for an official physical therapy evaluation. We will then determine if it is a right fit for them, and if we still need to do traditional skilled therapy in adjunct to that, or if they might just reap the benefits of the laser alone and there's not much else physical therapy wise that we can do for them. That is rare, but some patients do opt to just do the laser, and if they do so, that is totally fine, but it is $25 per body part. So they would just pay out of pocket. Now, if they are coming as part of an adjunct to the physical therapy treatment, then we just kind of roll that into our therapy costs during the session. So.
Okay. And so this is part of a rehab department.
This is, yeah. So we primarily the professionals that use it are our physical therapists, our assistants, and our occupational therapist. So.
All right. And is that unique, being a part of a rehab department and being another tool in the toolbox and part of that therapy plan for a patient? Is that really unique?
It is. I think a lot of these lasers are used more in like the wound side of things or in a podiatry office, and so I think that's why a lot of because technically it's not. We've made it work with our department, but it's not covered by insurance yet. I think that it will, in time it will, but I think that's why a lot of therapy clinics don't have it, is because of that, it's not covered, it's not reimbursed. So that's kind of, we're putting all this money into it and we're not able to get revenue back. But we saw a need in the community, and again, the foundation and the hospital backed us. So it was a huge thing, and again, that's why it's very unique and awesome that we have it here at our hospital.
Yeah. So once again, we gear this program toward the viewers. What symptoms would you say if a person is having that they might benefit from something like this? I mean, we talked about neuropathy and some joint pain. What's some other symptoms that if a person's watching that they might think
I think
about
it appeals to a lot of patients that have tried traditional physical therapy or tried, other means of rehab, and they've just had this chronic pain. Okay, those are the people that typically are seeking us out, and they want to try something else, try something new in addition to that. And so those are the ones we typically see, but it shouldn't stop there. I mean, if you have an acute elbow injury or ankle or knee problem, yes, you should come for skilled therapy too, but that is a good tool that we have available to us that we'll be able to use for that inflammation or for that pain in that area. So. Okay. Yeah.
Do you see any difference in the age of a person and how the treatment affects somebody, like someone who may be a senior citizen, or can this be used on children and
Well, we do have to that is one thing. We do have to stay away from the growth plates of children. Again, it's just not something that they've been able to research because of the potential side effects of affecting a growth plate. That would not be something most parents would let their children be part of research. So for children, we can do it, and we have done it, and it's been great. But we do have to stay away from those growth plates along their joint spaces. But I would say that for the really chronic, I've been dealing with back pain for 20 years. We're likely, I haven't seen a 100% removal of pain, but I have seen it lessen to a point where they have better quality of life. But for those particular patients, sometimes the laser's not going to be like a fully effect. Yeah, I don't have any pain anymore.
Right,
I'm like jumping around after 20 years. I finally don't have pain. That's not really realistic, but if we can lower it to the point where they can walk twice as far, or they can finally go to the store, or they can get in and out of bed better. Quality of life is the ultimate end game for this. So.
And when your feet hurt or when your back hurt, you just don't feel good. Everything
your
hurts.
Whole psyche, yeah. Just behaviorally, and you're just not usually in a good mental place either, but yes, you're right. So if we can even take a little bit of that pain and bring it down, that's our goal.
All right. Now, do you see a difference in men versus women? Is there any kind of, or is it pretty much the same?
No, I really haven't. You got to kind of, you got to kind of buy into it, and you got to kind of keep an open mindset on it. Some people hear laser and they're like, well, ho hum, but no, I think that no matter what gender, we're going to see the same amount of effectiveness. So.
Okay. Now, we also mentioned at the beginning of the program that we wanted to talk about injury prevention as well. And so we're talking about laser treatment. So what about injury prevention?
We've started this program, Momentum. So myself and our athletic trainer, Lisa Smith-Camp, have kind of been really rolling it out with a lot of help from our director Morgan and marketing and everybody else. So it's been it's coming. We're trying to get it going because it's such a need, and all community we've seen a much higher incident of injury in junior high and high school athletes. I think that's just kind of come over the years because of these kids kind of overtraining and not having enough downtime in an annual year. Really, they should have 3 solid months of rest, and that's just not happening with all the travel and the dual sport or tri-sport athletes and stuff. So it's hard to get that rest. It's hard for them to not get these overuse injuries, and if they already have the tendencies to have poor mechanics, those are the kids we're trying to find. We're trying to get them in our doors, find those mechanical problems, and fix them before it becomes a true injury or, a tear of the UCL or the ACL and the knee, MCL. So we're trying to get those kids and get things straightened out before it becomes a problem. So it's the injury prevention.
So it's more geared toward an age level.
Well, not necessarily. I started off with kids because a lot of training modeling you can do for junior high school aged kids, but even for adult athletes, it's from basically junior high, like 11 to adult. Though if you're going to get younger than that, they're not super coordinated already. They kind of have to come into their own, body, so it's not really effective for the younger ones. But for 11 to adult, they're our target area, and so that's even an adult that, might be training for a run or something, a race, and they're coming in and they're like, it's not a full-fledged pain, but I feel like mile 5 or so, I'm feeling this little like pain
twinge
here.
Or something.
What am I doing? Can you check it out? And so we'll do a functional movement screen. So it's an evidence-based screening tool that we'll use, and then we'll kind of score that and kind of analyze what's going on, tell them what's going on. And then for my runners, of course, I'll also do a running analysis. So I'll get them on the treadmill and I'll break down their running pattern from a couple different angles so that they know exactly and they see what they're doing, and that kind of really sets it into them of what they kind of need to fix. So it's fun for me.
Yeah.
I like getting these kids and fixing a potential problem so that they can stay on the court, stay on the field, stay on the track. So.
Right. So there's some education involved there as well.
It's a huge amount of education. For the younger kids, I love the parents to come back so that they can really see what's going on and say, like, no, you were right to bring them in. This was a good call. Like, you did see something. Yeah, they don't have pain yet, but that could lead to pain, and you're setting them up for better success in their future. So.
Okay. Now, is there a difference maybe with the sport that they play, or how do you want to explain this program depending on whether they're a different age, a different sport?
Yeah. So if we detect a problem and we see an area that could be worked on, then we are going to customize a sports-specific program for that athlete. So runners, of course, we're going to do a lot of core and a lot of hip and pelvic strengthening, because that's usually where the failing is happening. For my pretty much all athletes kind of neglect the core area. They don't think that it contributes as much as it truly does. You want to jump faster, you want to run, or jump higher, you want to run faster. You got to have a good generation of core power. So it's usually kind of where we start, and then we kind of work our way out and then get into the real grittiness of that sport-specific activity. And our athletic trainers are very educated, of course, on performance enhancement too. So our Momentum program started as an injury prevention program, but it's kind of molded into, yes, injury prevention, but also performance enhancement, which kind of go hand in hand. If we're fixing those mechanical faults from an injury prevention standpoint, we're also making those muscles and those joints work more efficiently, which is going to generate more power, going to make you faster, going to get those fast muscle twitch fibers
Make
going.
better athletes.
Yeah, so I mean that's a great side effect of this program as well.
Okay, now is something like this covered by insurance? How does that work?
It's not, no, and because it's not, you don't need a referral either. It's a paid out-of-pocket service, so it's the functional movement screen takes about 15 minutes, and that's going to be free, and then we can kind of do a quick analysis and give you some feedback of what we saw. And then after that, the 30 minutes is $30 for a session, which is really very reasonable, because we're giving you some very, skilled intervention in that 30 minutes, and it's one-on-one too. It's not like you're in a group setting, so you've got our undivided attention during those 30 minutes, and we're getting you moving. Like my kids in the Momentum program, I say kids because I haven't had an adult come through yet, but we have someone on the schedule. They're sweating by the end of it pretty good. So
That's a pretty good workout.
Yeah, they're working out pretty good.
So if
sometimes
parents,
I am too.
Yeah, so if parents are watching and they have a child who's involved in athletics of some sort, and they're noticing some sort of maybe a possible leaning toward an injury, how would they go about getting their child involved in this program?
They simply contact our department. So they call our rehab department. If they have any questions, then Lisa or I will be able to field those questions for them. And if they still want to go ahead and schedule, we'll go ahead and put them on the schedule. It's pretty easy, because they don't. Again, it's an out-of-pocket service, or fee for service. So we don't need a referral. So a lot of the doctors are on board with it too. Mostly at our hospital, we haven't got a lot of referral, but again, you don't need that referral either. So if the parent just sees that need, give us a call.
Give us a call. Yeah. Well, we want to take care of our kids, and make sure that they're healthy and their joints and muscles and everything are working properly. So prevention is key.
Right, and those kids can be super successful on the field, on the court, but they could be just using compensatory muscles and putting too much stress on those muscle groups. They could potentially lead to, your kids made a jump stop on the basketball court hundreds of times, and then now all of a sudden they make that one and their ACL, like a Derrick Rose situation, but that's because something was faulty. The quads weren't activating properly. There was a neuromuscular mishap going on. So if we can get that trained better beforehand, then it'll
keep that from happening.
Yes.
Try to prevent it from happening.
Research has been super supportive of the injury prevention program. One research article found that female athletes are 3.6 times more likely to have an injury that are untrained than a trained one, and a male athlete is 4.8 times more likely to suffer an injury. And that's just with non-contact injuries. So that's not, of course, this program, if kid's on the football field and he gets blasted on the outside of his knee, it's gonna probably tear his MCL and ACL.
And there's treatment for that.
But I mean, this program, those contact things, those are kind of outside of our hands and our control. But these were this research was supporting those non-contact injuries, that jump stop, that turn and pivot, that quick cutting. So those are the ones that we're trying to prevent that from happening. Those are those senseless ones that you're like, how he does that all the time, or she does that jump stop all the time. Like, why that time? And well, because there was something going on. There was something underlying going on, and we're trying to get those kids fix that before it becomes a true problem.
Okay, all right. So physical therapy has come a long ways, lots of advances. We just have a minute or two left. So is there anything that you want to cover that we haven't talked about yet? Resources that are available to parents or those seeking treatment for laser treatment therapy?
No,
Pretty much covered everything?
I think we have, really. I think you've done a very good job.
All right. Well, this has been an interesting topic. So for those people who are interested in MLS laser or injury prevention, I want to thank you so much for coming in the studio today and talking about this. And thank you so much for all of you who have joined us for this episode of Being Well. We hope it has been educational, and we talked about MLS treatment and injury prevention today with Paris Community Hospital and Danielle Colvin. Thank you so much.
Thank you.
Thank you for watching.
Production of Being Well is made possible in part by
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.